Welcome to Manage It Monday.
Hey everyone, I'm Rochelle Howell. Welcome back to another episode of Manage It Monday. This is the place where we break down food safety and business strategies in a way that's practical, manageable, and useful for your business. Today, we're talking about sick employees coming to work. Now, I know some of you all may be thinking, well, if they don't show up, I'm short-staffed and we're already understaffed anyway, so... But hear me out, people. One sick worker can be the reason your business gets shut down. It's not just about your employees' personal health or about whether you're legally required to offer paid sick leave. It's really about protecting your customers because foodborne illness outbreaks can ruin lives, protecting your business because one outbreak can get you fined, sued, or shut down, and your reputation because one bad review about food poisoning spreads fast. Did you know in the United States about 48 million people get food poisoning every year? That's 1 in 6 Americans. Globally, norovirus alone causes 125 million illnesses and 35,000 deaths annually. And most foodborne illnesses are preventable with a strong employee health policy and strict food safety practices. So in this episode, we will cover the requirements for sick employees, give you some real-world examples, what you need to have in your employee health policy, and of course, your Manage It action for the week so you can apply what we've learned. Now, let's get to it. In food safety, not every sick employee is the same, and not every illness requires them to stay home. The FDA Food Code, which local health departments use to create their own ordinances and codes, has some clear rules about sick employees and what actions you need to take. A sick food worker is someone who can spread illness through food because they are experiencing symptoms linked to foodborne pathogens. According to the FDA Food Code, symptoms that require immediate action are diarrhea, one of the fastest ways a foodborne illness spreads, vomiting, which could be due to norovirus, the number one cause of foodborne outbreaks, jaundice, which includes yellowing of the skin and eyes, a sign of hepatitis A, which can survive on food for months, sore throat with fever, especially dangerous for high-risk populations, and open infected wounds or boils, if they are on the hands, wrists, or arms. When an employee reports these symptoms, managers are responsible for determining whether they should be excluded or restricted. Remember, just because someone is sick does not mean they have to stay home. The FDA Food Code has 2 levels of actions. The first is exclusion. In other words, stay home. This means the employee cannot work in the facility at all until the symptoms are gone. This is required for employees with diarrhea or vomiting in the last 24 hours. They need to wait 24 hours with no vomiting or diarrhea before coming back to work. It also applies to jaundice. They can't come back until it's medically cleared. Or a diagnosed foodborne illness like norovirus, E. coli, hepatitis A, or salmonella typhi. The second is restriction. You can work, but nowhere near food. This means the employee can still be at work, but cannot handle food, utensils, or anything that touches food. Let me give you some examples. An employee with a sore throat and a fever can work in a non-food prep area, like putting away paper goods in a warehouse or a back room. Someone with a minor infected cut can work with a bandage and a glove. Keywords, minor infected cut. So why does this matter? Because many food business owners don't understand these rules and allow sick workers to stay on the line when they should be excluded. A worker prepping food with norovirus can infect dozens of people in hours, and not following exclusion and restriction rules is a major health code violation. Knowing when to exclude or restrict employees protects your business and customers. Let's talk about the real risk. Here's what happens when people don't follow health regulations. Foodborne illness outbreaks happen. Hepatitis A, norovirus, E. coli, and salmonella are often spread by food workers. The CDC reports that 40% of foodborne illness outbreaks in restaurants are linked to sick workers handling food. Infected workers don't always show symptoms immediately, so they could be making people sick before they even realize it. So pay attention. An example of foodborne illness outbreak is McDonald's E. coli outbreak in 2024, which led to 1 death and dozens of illnesses across multiple states. The contamination was traced back to onions from a supplier, but it was made worse by improper handling at the restaurant. What else happens when people don't follow health regulations? The health department can shut you down. If an outbreak is linked to your business, health inspectors will investigate. I know because I've participated in a few of these outbreak investigations in my years. In Chicago, New York, California, and many other states, a confirmed food break illness outbreak can result in an immediate closure. If an inspector sees an employee working while sick, they can issue a critical violation or suspend your food permit. It's that important. In 2019, a nationwide hepatitis A outbreak resulted in over 300 deaths. Many of these cases were linked to infected food handlers. Some restaurants faced permanent closure after being identified as a source. What else can happen? You can be fined or sued. Foodborne illness lawsuits can cost thousands and even millions of dollars. If an outbreak is traced back to your business and you did not enforce sick employee leave policies, you are legally responsible. Businesses can also be fined for not following employee health reporting. So do it before that special lawyer shows up. That Chi-Chi's hepatitis A outbreak in 2003 is an example of this. It was caused by contaminated green onions and led to over 650 infections, 4 deaths, millions in lawsuits, and the restaurant chain going bankrupt. Your reputation can be destroyed overnight. One bad Yelp or Google review about food poisoning can spread so fast on social media. And if your business gets shut down for a foodborne illness outbreak, you're gonna have to work hard to get those customers back. Just ask Chipotle. Now, I get it. Some food business owners worry about giving too much time off. But let's be real. The cost of one outbreak outweighs the cost of giving someone a few sick days. Speaking of sick days, did you know in Illinois, employees are entitled to 40 hours of paid leave per year? And many other states have similar laws. It's not just for vacation. And in other parts of the world, many countries don't have strict food safety policies. But if you want to scale your business with the international community, you must think about sick employees handling food. Tourism is a good thing. And when we see you have the same food safety standards in your business that we have here, we're going to spread the word. Bottom line, letting a sick food worker stay home is way cheaper than dealing with a lawsuit, a shutdown, or a destroyed reputation. Now that we understand the problem, let's talk about managing it. In the United States, obtaining a health permit for a retail food establishment, such as a restaurant, usually requires submitting an employee health policy. According to the FDA Food Code, which of course many local governments have adopted and used to regulate their food establishments, you must have a written policy detailing how you will address employee health to prevent foodborne illness, and it must include an employee sign-off. When I worked for Save-A-Lot, one of my responsibilities was to develop employee wellness and food safety policies. I encountered firsthand the complexities of varying state regulations. For example, in Ohio, the state mandates that food employees report specific symptoms and diagnoses to the person in charge, and they have additional diagnosed illnesses that must be reported that I didn't see in other states. The person in charge is then responsible for notifying the local health department and ensuring appropriate measures are taken, such as excluding or restricting the employee from food handling duties. In Missouri, in response to hepatitis A outbreaks, certain counties implemented mandatory vaccination policies for food handlers. For instance, St. Louis County required all restaurant workers and individuals involved in food prep to receive the hepatitis A vaccine. This ordinance applied to various establishments, including hospital cafeterias, school kitchens, daycares, mobile food businesses. Anyone handling food needs to have it. The challenge for me was developing a uniform employee health and wellness policy that complied with all the different regulations in the various states that Save-A-Lot was in. And I was successful. So I want to discuss how you can be successful too. Here are the essential components of an effective employee health policy and how you can implement them. Number 1, clear reporting procedures. Clearly outline which symptoms employees must report before starting their shift. Specify which diagnosed illnesses require immediate notification to a manager. Number 2, define exclusion and restriction criteria. Detail scenarios where employees are prohibited from working entirely, like if they were diagnosed with a reportable foodborne illness. Describe situations where employees can work in non-food handling capacities. Number 3, vaccination requirements. Consider mandating hepatitis A vaccinations, especially in areas prone to outbreaks or where local regulations require them. And number 4, training and education. Conduct sessions on hygiene practices, illness reporting, and the importance of vaccinations. Provide accessible resources that reinforce policy guidelines and health practices. Number 5, documentation and record keeping. Maintain records of reported illnesses and the corrective actions taken. Keep updated records of employee vaccinations per your policy requirements. Number 6, management responsibilities. Outline the steps your managers must take when they receive an illness report, including notifying the health department if it's required. And establish support for employees during illness, such as return to work policies. The FDA Food Code also mandates that food establishments have procedures for employees to follow when responding to vomiting and diarrheal events. So now these procedures are about minimizing the spread of contamination and exposure to pathogens. An effective vomiting or diarrheal event cleanup plan should include immediate area segregation. Isolate the affected area to prevent further contamination. It should include protective equipment. Your staff should use disposable gloves, aprons, masks, and shoe covers when they're cleaning up. Proper disposal. Contaminated materials should be carefully removed and disposed of in sealed plastic bags. Disinfection. Clean the area with an appropriate disinfectant that kills norovirus. Hand hygiene post-cleanup. After the employees finish cleaning up, they must wash their hands and, if possible, shower and change clothes. So now let's summarize all this information from today. Here are my key takeaways. Employee health policies are required by law. Sick workers must stay home. Diarrhea, vomiting, and jaundice are red flags. Health departments can shut you down if employees work while sick. Foodborne illness outbreaks can bankrupt businesses, and paid sick leave is actually cheaper than dealing with a shutdown. So for this week, I want you to locate and review your employee health policy, and then ask yourself, does it clearly outline the symptoms employees must report? Does it define exclusion versus restriction rules? Does it include a hand washing and cleanliness policy? Does it have a vomit and fecal cleanup plan? And does it meet your local health department's requirements? And if you don't have a policy or yours needs updating, then I've got you covered. Download my editable employee health policy package. It includes your health policy with a reporting agreement and an illness log, hand washing and cleanliness policy to ensure proper hygiene, vomiting and fecal cleanup plan, and a log to handle incidents safely. And it includes the hepatitis A policy and a vaccine record log for compliance and tracking. So grab it now at thepaperworkchef.com and protect yourself and your business. All right now, you business leaders, managing food safety isn't about perfection. It's about putting the right systems in place to protect your business, to protect your employees, and to protect your customers. This week, take control. Get your employee health policy in place, train your team, and protect your business. Remember, Monday is the perfect day to manage the week. I hope you are motivated. And if you are, please like this video and share it with another leader. Now, I send you all positive energy for the week, and I will see you next Monday.